Alright, so we're going to finish up with the circulatory system and talking about the heart. So how can you have a heart attack when the heart is full of blood? Well, kind of like how we talked about with red blood cells, their job is to deliver oxygen so they don't use oxygen. Well, your heart's job is to deliver blood, and so it doesn't use any of the blood that is inside the heart to power the heart. It only uses the blood that comes to specifically the heart's circulatory system. And so it comes out right here at the base of the aorta, and then all the arteries come to deliver the blood, and the veins take the waste back here to the right atrium. And so what a heart attack is these heart muscle cells need a lot of oxygen because they're always working, and they use that oxygen to make energy. And if they don't have enough blood supply, that they're not getting enough energy, and they get a built-up of lactic acid that can then go ahead and kill those heart muscle cells, something called ischemia. So you can get cardiac ischemia, or these dead cells from not getting enough blood flow. And so our heart has its own circulatory system where we have the right coronary artery coming out, and then you have a left coronary artery coming out on this side to start delivering the blood to the heart. As the left comes out, it comes down, and you get your anterior interventricular artery. It's a really long name, but it tells you exactly where it is. So it's anterior, it's in the front of the heart, and it's interventricular. And so it runs along this interventricular septum, where it separates the right and the left ventricles from each other. And here you can see your left coronary coming out, turning into your circumflex artery and this anterior interventricular artery. And so there's the circumflex wrapping around to the back side. So when we do come around to the back side, here you can see that left circumflex again. Here's your right coronary artery. And then it comes down with your posterior interventricular artery. Again, telling you where it is on the back side between the two ventricles. And then you have your great cardiac vein up here, which is returning the blood to this coronary sinus, along with your posterior vein. This posterior vein is on the left ventricle and then comes back to the coronary sulcus to put the blood into that right atrium. Then you have your middle cardiac vein running along or parallel to this posterior interventricular artery. So whatever blood this one's given, that middle cardiac vein is then returning to your coronary sinus. And then over here you can see your right coronary wrapping around. And then there's the coronary sinus. So this coronary sinus drains into the right atrium along with the superior vena cava and the inferior vena cava. So if we cut into the heart, here you can see that right atrium. And then as it comes down from the superior vena cava, up from the inferior vena cava, and right there is the opening for the coronary sinus. Things to know is, so here's your aortic arch, and if you remember your ABCs, we have A for aorta, B for brachiocephalic, C for left common carotid, and then your S for left subclavian, and then it becomes the descending aorta. Moving over here, you can see your superior vena cava, and coming down, your right pulmonary artery. So as the blood leaves this right ventricle, so it pumps from the right atrium down into the right ventricle and then out through this pulmonary trunk. And then that trunk splits into the left and the right pulmonary arteries to go to the lungs. And so these are carrying deoxygenated blood. Still arteries though, because they're going away from the heart. Here you can see your ascending aorta, so as the blood comes in the left atrium, down into the left ventricle, and then out your ascending aorta. And right about here, right after, or right before this aortic valve, this semilunar valve, you're going to have your coronary arteries coming out. And then we have your valves. This will be your right AV valve, or the tricuspid valve. Tricuspid, it says there's three cusps, or there's three little flaps that work on this heart. These flaps are connected via these chordae tendineae, or the heartstrings, that are anchored by these papillary muscles. And then you can also see this network of trabeculae, carnae trabeculae, of the heart muscles lined with endothelium. So these cells are not getting or not using the blood that are in these chambers because, you know, you have that cardiac circulation. There's your chordae tendineae, your papillary muscles to anchor it. And then this is the right ventricle. So the right ventricle pumps blood to the lungs. How far is the heart from the lungs? Well, if you take your fist and put it pretty much in the center of your chest, maybe off just a hair to the left side, that's where your heart is. And those lungs are right beside it. And so if you look at the outer wall of the right ventricle, it's really thin because it doesn't have to pump the blood very far. Versus if you look at the left ventricle and the muscle in that outer wall, it is really, really thick because the left ventricle has to pump the blood to the rest of the body. Here you can see your inferior vena cava coming up into that right atrium. So this is returning all the blood that is in the lower half of the body. Over here to the other side, again, that trabecular carnae. This trabeculae is lined with those endothelial cells, so they're not using the blood in the chamber. Here you can see the interventricular septum. So you have that anterior and posterior arteries that went down that interventricular septum. And this is what we're talking about, separating the right and the left ventricles from each other. And then here's your left ventricle, the side that's going to pump the blood to the entire body. Here's your left AV valve, or the mitral valve. Call it the mitral valve because it kind of looks like a mitre. A mitre is the type of hat that the Pope wears, that kind of pointy hat with the two sides. They say it kind of looks like that. Typically, if anybody has a heart murmur, it's because this valve here is allowing some blood to flow back, because this valve is under a lot of pressure. Because you got to think about how hard that left ventricle has to beat to push the blood through the entire body. Well, it's pushing on that valve to push that blood out. And so it's under a lot of pressure, and typically if somebody is going to have a heart murmur, it's due to a prolapse of this mitral valve. You get a little bit of mixing back up into that left atrium. Here you can see the aortic valve. Sometimes these are called semilunar valves because they kind of look like half moons. And so as the blood pumps out, it opens up that, and as the blood starts flowing back, it closes that valve. So as gravity pulls that blood back down, it'll close those valves. They kind of fill up like parachutes with blood and then shut. Here you can see your atrial septum right there, separating the left and the right atria. You can see the fossa ovalis right here. What this is when you're a baby, when you're in utero, when you're inside of your mother's uterus, are you breathing oxygen? You're not. You're not breathing anything, right? You can't breathe anything. There's no air. If you breathe that amniotic fluid, your lungs would be filled with amniotic fluid when you came out, and you would drown as soon as you were born. Instead, you use the oxygen that is in your mom's blood, right? And so when you're pumping your blood and using that oxygen, you don't have to go to the pulmonary circuit. You don't have to pump the blood to the lungs because you're not breathing oxygen. Instead, this fossa ovalis can allow blood to go from the right atria to the left atria and then out to the rest of the body. And so it's kind of like putting in a shortcut in your body when you're not breathing your own oxygen. Sometimes that doesn't fully close in newborns, and you'll have to go in and repair that. All right, and here you can see the pulmonary veins, so the veins coming back from the lungs. Again, they're veins because they're returning to the heart, but they're shown red here because they are oxygenated, because they are coming back from the lungs. So you have your left pulmonary veins. Over here that you can't see, you would have your right pulmonary veins. Again, those pulmonary arteries we talked about already. Here you can see your pulmonary valve, or your pulmonary semilunar valve. It looks exactly like the aortic semilunar valve, these little half moons that act like parachutes when the blood flows back down. The pulmonary trunk, before it splits into left and right. Your left subclavian, your left common carotid, and we have gone over the heart. Cool little side note, if you laid your circulatory system out in a straight line, so piece by piece, you can circle the earth 2.5 times. There is a ton of little vessels throughout your entire body. So much that you can circle the earth 2.5 times. Very cool. Alright, so with that, we'll be having our next test. And best of luck on it.